The body is like a quiet child. It doesn't always speak out loud, but it will act out when something's wrong. The question is, are we paying attention? Did you know that one of the most overlooked warning signs of cancer, especially in older adults, is something as simple as an unexplained itch? Yes, just an itch. No rash, no bump, no visible cause, just a strange, stubborn itch that won't go away. And here's the surprising part. Almost 99% of seniors ignore it. Most say it's probably dry skin or a new soap. Nothing serious. But sometimes it's not just aging. Sometimes it's your body whispering a warning, long before pain or other symptoms appear. In this video, we're going to reveal 5 specific itchy spots on the body that could be early signs of cancer. These aren't random itches. They've been seen repeatedly in patients who were later diagnosed with serious conditions, like lymphoma, pancreatic cancer, or even inflammatory breast cancer. Now don't worry, this isn't about panic, it's about awareness. Because the sooner we notice the subtle signs, the better our chances of catching something while it's still treatable. So stick with me until the end. You may not only learn something important for yourself, but possibly for someone you care about too. In this video, we're going to uncover 5 specific itchy spots on the body that older adults often ignore. Yet doctors have linked them to early warning signs of cancer. These aren't just random itches or dry skin flare-ups. These are patterns that have shown up in people who were later diagnosed with serious illnesses like lymphoma, pancreatic cancer, breast cancer, or leukemia, sometimes months before any other symptoms appeared. For each spot, we'll explain where the itch happens, what kind of cancer it might be related to, why it happens medically, and how to tell if it's just a skin issue or something deeper. You'll also hear true stories from people over 60 who went through this. Their journeys show how a small, persistent itch turned out to be the first clue their body was giving them. But this isn't a video to scare you. This is about being aware, not afraid. Because cancer in older adults doesn't always start with pain or lumps. Sometimes the body whispers before it ever shouts. And those whispers, they matter. So if you're over 60 or love someone who is, please watch this all the way through. The more you know, the better decisions you can make. And if just one person watching this catches something early, it's worth it. Now let's begin with the first spot, an itch that may seem harmless, but could be your body's first quiet cry for help. Sign 1. Persistent itching in the lower legs, shins and calves. Let's start with one of the most common but most ignored itchy spots, the lower legs, especially the shins and calves. Now, if you're over 60 and you've noticed a strange, ongoing itch in this area, no rash, no new soap, no dryness, don't just shrug it off. Many seniors do. They blame aging skin or maybe even bug bites. But here's the truth. This kind of itch has shown up again and again in people with blood-related cancers, especially lymphoma. What makes it different? It's deep, almost like a burning sensation beneath the skin. It doesn't respond to lotion, and it often gets worse at night. There's no visible irritation, yet it keeps coming back. Medically, this happens because cancers like Hodgkin's lymphoma affect the lymphatic system. As cancer cells grow, they release chemicals that inflame the nerves, leading to a nerve-level itch. Even when your skin looks perfectly normal, your nerves are crying out. Let me tell you about George, a 75-year-old retiree. For 6 months, his legs itched every night. He tried creams, changed soaps. Nothing worked. His doctor first thought it was eczema. But after routine blood work, his white cell count was off. Scans showed swollen lymph nodes in his chest. It was early-stage lymphoma. The itch, that was his only symptom. This isn't about assuming the worst every time you scratch. But if that itch lingers, if it doesn't respond to anything, and especially if you also feel tired, sweaty at night, or are losing weight without trying, please don't ignore it. Our bodies don't always scream when something's wrong. Sometimes they whisper, and sometimes that whisper starts in your legs. If any of this sounds familiar, drop a comment below with the number 1. And if you haven't yet, hit that subscribe button and ring the bell so you don't miss the rest of this life-saving series. Sign 2. Itching between the shoulder blades or upper back. Now let's talk about an itch that's often dismissed as just tension or dry air. If you've been scratching between your shoulder blades, that deep spot on your upper back, and nothing seems to help, this next part is for you. Many older adults feel a strange, nagging itch in that area and blame it on a shirt tag, an old mattress, or even poor posture. But here's something most people don't know. Persistent itching in this specific spot has been linked to early signs of pancreatic cancer. Sounds surprising, right? After all, the pancreas sits deep in the abdomen. So how could it cause an itch on your back? Here's how. When tumors grow in or near the pancreas, they can block the bile ducts, which normally help drain bile from the liver. When that drainage backs up, bile salts start building in your bloodstream, and one of the first things they do is irritate nerve endings, especially in areas like the upper back where sensory nerves are dense. This isn't your typical dry skin itch. It's deep, persistent. It often feels like it's coming from underneath the skin, and it doesn't go away with creams or back scratchers. I remember a woman named Linda, age 70. She called it her phantom itch. She'd wake up scratching it every night, and nothing worked. Finally, after a checkup for unrelated fatigue, her liver enzymes came back high. Further scans showed a small tumor pressing on her bile duct. Her itch? That was her first warning sign. So if you, or someone you love, has been dealing with this kind of itch day after day, and especially if it's paired with fatigue, dark urine, or pale stools, it's time to speak up. Don't be embarrassed to bring it up. Your body is wise, and when it repeats a signal, it's trying to tell you something important. If this resonates with you, leave a comment with the number 2 below. And if you're finding this video helpful so far, please subscribe and share. You never know who might need to hear this. Sign 3. Itchy scalp without dandruff. Let's move to a spot we often ignore, the scalp. If you're over 60 and your scalp itches, but there's no dandruff, no redness, no new shampoo to blame, that itch might be more than just a dry scalp. Many older adults chalk this up to weather, aging skin, or even tight hats. But here's the surprising part. Persistent, unexplained itching on the scalp has been linked to early signs of leukemia and skin cancer. This kind of itch feels different. It's not flaky or scaly like dandruff. It feels like tingling, crawling, or even a light burning sensation, sometimes moving from spot to spot. And most importantly, no product seems to help. The reason? Blood cancers like leukemia can throw off your immune system, triggering inflammation that irritates nerves just under the skin. This often shows up first in sensitive areas, like the scalp, before any other symptom appears. Let me tell you about Henry, 73. He started scratching his head every afternoon, changed shampoos, tossed out his hat. Nothing helped. He finally asked his doctor during a routine visit. Blood work revealed abnormally high white blood cell counts, and later tests confirmed early-stage chronic lymphocytic leukemia. The itch? That was the only clue his body gave him. And skin cancer? It can hide in plain sight. A small, itchy patch on the scalp, especially if you have thinning hair, might be more than it looks. If it doesn't heal, keeps itching, or feels thickened, it's time to let a doctor, or even your barber, take a closer look. So if your scalp's been acting up and no cream, oil, or shampoo seems to help, don't just assume it's nothing, especially if you've also been feeling more tired than usual, bruising easily, or just feeling off. Remember, our bodies don't always give us loud alarms. Sometimes it starts with a whisper you feel on your skin. If this sounds like you or someone you love, comment the number 3 below. And don't forget to subscribe for more eye-opening health insights made just for you. Sign 4. Itching on the chest or breast area. Now let's talk about a spot that's even easier to dismiss, the chest or breast area, especially in older women. But men too, this is where subtle symptoms often get ignored. If you've been feeling a persistent itch around the nipple, under the breast, or across the chest, and it won't go away no matter what cream or detergent you try, it's time to pause. This kind of focused, unrelenting itch, especially without a rash, has been linked to inflammatory breast cancer or even lymphoma in nearby lymph nodes. Here's what makes it tricky. This cancer doesn't always form a clear lump like we expect. It often starts with skin changes, a patch of irritation, a feeling of warmth or tightness, or even slight dimpling or thickening of the skin. But for many, the first and sometimes only symptom is a deep, nagging itch that never moves. I'll never forget Ruth, age 69. She had this stubborn itch just below her right breast. Switched bras, changed detergents, went braless. Nothing helped. She even laughed and said, "Maybe it's just me getting old and sensitive." But her instinct told her something felt wrong. Her doctor noticed slight skin puckering and sent her for scans. The result? An aggressive but small tumor, right near the surface. Men, don't tune out here. Male breast cancer exists, and it often flies under the radar because no one expects it. An itchy spot near the nipple or under the chest muscle? It's worth checking, especially if it lingers in one place. And remember, this itch could also signal enlarged lymph nodes under the arms or collarbone, which may point to other hidden cancers. If your itch stays in the same place, doesn't heal, and nothing soothes it, don't ignore it. Awareness is power. Early detection isn't fancy. It's about noticing what your body repeats. If this speaks to you, comment 4 below. And if you haven't yet, subscribe and turn on notifications. We're here to help you stay informed and proactive. Sign 5, itching in the genital or anal area. Let's be honest, this is the one area nobody wants to talk about, but we need to, because sometimes what feels embarrassing to mention could be the one thing that saves your life. If you're over 60 and have been dealing with persistent itching in the genital or anal area, and nothing seems to make it stop, please don't brush it off. Yes, sometimes it's dry skin, a hygiene issue, or irritation from products. But if the itch lingers for weeks or months, feels raw, burning, or deeper than the surface, and especially if it keeps returning to the same exact spot, it might be something more serious. Doctors have found that chronic itching in this area can be an early symptom of anal cancer, vulvar cancer, or even penile cancer. Take Eugen, age 76. He thought his discomfort was from hemorrhoids. He tried creams, changed his diet, avoided sitting too long. Nothing helped. Eventually, a specialist did a scope exam and found a small lesion inside his anal canal. It was cancer, caught just in time. For older women, vulvar cancer often begins this way too. The skin might feel thinner, rougher, or look slightly discolored. And because menopause already causes dryness, many just assume it's normal aging. But if it doesn't respond to treatments and the itch gets worse at night or keeps returning, it's worth getting checked. This area has many nerve endings, making it a sensitive messenger. Sometimes it's the first place the body tries to signal internal changes, whether from the skin, nearby lymph nodes, or deeper tissue. So don't let discomfort or embarrassment keep you silent. Being cautious isn't overreacting, it's being wise. If this sounds familiar to you or someone close to you, comment number 5 below. And if you appreciate learning these quiet signs your body may be showing you, make sure to like, share, and subscribe. Someone else may need this more than you know. Between each sign we've covered, I hope you're starting to see a pattern. These itches may seem small, even silly at first, but they're not random. They're part of your body's early warning system. And the key isn't to panic, it's to pay attention. So if any of these signs sounded even a little familiar, I want to ask you for 2 small favors. First, drop the number 1 to 5 in the comments below for the sign that hit home for you. You never know who might read your comment and realize they're not alone. Second, if you're finding this video helpful so far, please consider subscribing and turning on notifications. It's a small act, but it helps us reach more seniors, caregivers, and loved ones who need this kind of information. We're not just building a channel here. We're building a community of awareness, a space where we speak up about the things that matter. Even if they're uncomfortable, even if they're just an itch. All right, take a deep breath. You've come this far with me. Let's wrap it up with one final thought that could change how you listen to your body from now on. Let me leave you with something I deeply believe. The body speaks in whispers before it ever screams. And those who listen early heal earlier. We've talked today about 5 very specific itchy spots on the legs, back, scalp, chest, and genital area that most people ignore, especially seniors. And maybe now you understand these aren't just odd little itches. They're potential early signals of something your body's trying to tell you. Not every itch means cancer, of course, but when it doesn't go away, when it's always in the same place, when it doesn't respond to lotions or treatments, and especially when it comes with other subtle signs, that's when it's time to speak up. You don't need to live in fear. That's not the message here. The message is you deserve peace of mind. And sometimes peace of mind comes from noticing the small things and having the courage to ask about them. If something you heard today felt familiar, don't ignore it. Talk to your doctor, ask questions, show them this video if you need to, because the earlier you catch something, the easier it is to treat. And if it turns out to be nothing, that's still a win. That's still relief. Before you go, I'd love to hear from you in the comments. What was the most surprising thing you learned today? How will you pay closer attention to your body from now on? And if you found this video helpful, please like, share, and subscribe. Your support helps us keep creating content that empowers and informs people just like you and just like the people you love. Thank you for spending your time here with me today. Until next time, be well, stay aware, and always listen to your body.